This is Dr. David Burt demonstrating arthroscopic repair of the inferior labrum from anterior to posterior. I have no relevant disclosures. The surgical position is lateral decubitus with 60 degrees of abduction, 10 degrees forward flexion. The posterior viewing portal is 2 centimeters inferior and 1 centimeter medial. The accessory posterior lateral portal, which can be used for anchor placement, is 2 centimeters inferior, 1 centimeter lateral to the posterior lateral acromion, and typically provides a good trajectory for posterior and posterior inferior anchor placement. The anterior view demonstrates an anterior superior portal just off the anterior acromion and an anterior inferior portal 3 centimeters below that and lateral to the coracoid process, both entering the joint with an outside end technique, the anterior inferior portal entering just above the subscapularis tendon. Arthroscopic view of the Cateveric specimen in the left shoulder, viewing from posterior. The needle is localizing the anterior superior portal through the rotator interval, and now localizing the anterior inferior portal just above the subscapularis tendon with the appropriate trajectory for anterior anchor placement. Both cannulas are dilated in place. The remainder of the procedure is done viewing from anterior superior. With that view, the obturator is in the viewing portal posteriorly, and the needle is localizing the accessory posterior lateral portal, demonstrating the tear that we've created in this cadaveric specimen. The portal is created, and this shows the tear of the inferior labrum from anterior, wrapping around to posterior. A burr is used to debride the glenoid margin down to bleeding bone. The cannula is placed, and the anchors are then placed. The first posterior anchor is placed approximately at the 5 o'clock position posteriorly, 1 to 2 millimeters onto the glenoid face, utilizing a suture passing device that is angled to the right for the posterior aspect of the repair. Care is taken to pass suture around labral tissue only, at or near the level of the anchor, to avoid shifting or capsular plication type of maneuvers to overconstrain the joint, with the goal being anatomic restoration of labral position and labral bumper effect without a shift and without a plication. Standard knot tying techniques are utilized with a simple sliding knot with past pointing to lock the knot, and then 3 alternating half hitches to maintain good loop and knot security. The original posterior viewing portal can also be used for percutaneous suture management or for a 4th cannula placement. The second posterior anchor is placed again 1 to 2 millimeters onto the glenoid face at approximately the 4 o'clock position, and the same sequence is performed. An angled to the right suture passing device is used at or near the level of the anchor placement. Suture is shuttled and managed through the anterior inferior portal, and we're viewing from the anterior superior portal. And the same knot tying sequence is used with a simple sliding knot and alternating half hitches. And that completes the posterior aspect of the repair. Again, viewing from anterior superior, we're now working anterior inferior through the anterior inferior cannula, and the third anchor is placed approximately at the 7 o'clock position. Suture is managed and shuttled through the posterior lateral portal at this point, and a suture passing device angled to the left is used, again passing around labral tissue only at or near the level of the anchor placement. The knot tying sequence is performed. And this completes the anterior inferior repair. The final anchor is placed approximately at the 8 o'clock position with the same suture passing technique and knot tying techniques to complete the repair of the inferior labrum. Once this is done, the labral bumper effect is restored and the anatomic position of the inferior labrum is restored. Viewing from anterior superior, the joint is well balanced, and we've retensioned the anterior and posterior bands of the inferior glenohumeral ligament.